Dear Janet Schwartz, how are you?
I am good, Dan. How are you?
Good. You have such a lovely corner there. It's all designed for video. Little picture, plant. Very good. And so, Janet, very early in our joint collaboration many years ago, we did a project on dentists. And this was with the dental insurance company. And what was the paper about? What did we actually end up showing?
So the paper was about whether or not established relationships with healthcare providers was economically and perhaps physically costly for patients, right? So if you think about
Costly for patients.
costly for
So,
patients,
so
costly for
basically,
patients. So basically, the more you have a relationship with a one service provider, which of course is this it's a cornerstone of medicine, this continuity of care. But does it create conflicts of interest, and does it make patients more susceptible to physicians or healthcare providers' conflicts of interest, right? And
yeah.
so originally we had thought about this in terms of second opinions and how likely is it that people would get second opinions based on the longevity of their relationship with their dental providers. And the reason that we chose dental care is because it's really something that people pay mostly for out of pocket. So
Plus,
this is not
plus we
something
had plus we had data.
Yeah, so plus we had data, but we started out with very experimental data, manipulating people's perception that they had been seeing a dentist for a very long time versus recently, and then also manipulating the recommendation, right? So a recommendation that was either more or less costly, but what we would consider to be clinical equipoise, meaning that both treatments are equally durable, equally likely. One is more cosmetically advantageous, perhaps, and significantly more expensive. So our question was whether or not in these situations, people would be more likely to go with the dentist recommendation for the more expensive of the two clinically equivalent treatments, given the longevity of the relationship with their dentist. And of course, experimentally in hypothetical situations, we did find evidence of that. And then we were able to work with Delta Dental. They were very generous with their data. And they said, we don't track whether or not patients are getting second opinions, but we do know the longevity of the relationship based on the claims data, right? And so they were very generous, and they gave us about 12 years worth of claims data, and we worked with us very closely to figure out where are these, in their codes, where are these situations in which patients, the dentist had an option, right, to go with either one treatment or the other treatment. One treatment was more expensive. And then in these claims, we could also see the length of the relationship with the dentist, between the dentist and the patient.
That's right.
So,
And the question was, if we look at the length of the relationship, is it that as the relationship progresses and dentists have choices between something that is more financially beneficial versus saves money for the patient, what are the choices that we end up seeing? And
exactly. So, and this is because we're looking at claims data, is there essentially a correlation between the out-of-pocket cost, right? Because the patient has to bear the difference between, for the more expensive treatment, the patient really has to pay a higher out-of-pocket cost. The insurance company will only cover what they cover, right? So if the dentist opts for a more expensive treatment and the patient agrees to it, it means that the patient has to pay more out of pocket. So we look to see, is there this relationship, right? Is the relationship, the length of the relationship, or the frequency, right? Not even so much the length of the relationship, but the frequency of the interactions. The more we interact with a particular service provider, are we more or less likely to be subject to this upselling and accepting of the upselling? And of course, that's exactly what we found in the data, right? So very consistent
yes,
with
and
our...
this is kind of the notion that loyalty is a mix, or continuity of care is a mixed blessing, right? On one hand, we have the same doctor, we know them. In this case, it's dentist, but we think it's more general. Trust is increasing. And then the question is there a downside to the trust? And the results show that yes, there is some downside, and presumably the dentists feel more free to act on their conflicts of interest, and the patients are more likely to accept that. And that's, of course, very, very complex for the medical system and for dentists. And then two things happen after that. The first one, that when we published the paper, the first was what happened with dentists. Do you remember the reactions we got from dentists?
So I think dentists, unsurprisingly, were very upset about these findings, right? Because it's very, we don't think, particularly as experts, that we're biased or that we're subject to bias. And so for this data to be published showing evidence in the claims that there was evidence of bias, evidence of upselling at patient, at patient's expense, both in terms of the durability of the treatment and in terms of the out-of-pocket cost. And I think, to any expert, they would say, this is absolutely not true. Other dentists may do this, but I certainly don't do it, right?
Yeah, and it wasn't just cost. There were some treatments that they were not doing what they're supposed to be doing by the standard of care, and they do more expensive.
Exactly. So it was not just that the treatment was more expensive, it was potentially less durable over time, meaning that the expense would continue, the treatment could fail, right? Yes. Whether it was a prosthetic tooth or something like it just wouldn't be as durable.
As good. Yeah. So it's both more expensive and less durable. And I got lots of emails from dentists, and they all started by.
You got all the emails from dentists.
And the emails were all of the form, you idiot, you don't understand dentistry, we never do that. We don't have conflicts of interest, we always do what's best for our clients. and the way I responded was to say, let's not talk about dentists for a second. Let's talk. I actually had the response prepared already because I had so many of them. And I said, let's talk about heart surgery. And I said, do you think that physicians sometimes put stents into people when there's not a real medical evidence that that's the right approach, but it's expensive and costly, and physicians do that? And the dentist response was, yes, they do it. That was a time where actually some results about the inefficiency of stents, that generation of stents, came out. And then I said, and don't you think that this might apply to dentists? And then they say, well, maybe some dentists, but not me. And then it continued. So that was very painful. By the way, my dentist was very upset. Can you imagine? I don't know if I told you, but going to my dentist a little bit after this paper was published was a challenge. But then another dentist in Chapel Hill called me, and he asked me to come to him. And he said he comes from a different school of dentistry and so on. Okay. It is tough, by the way. Studying conflicts of interest means that when we go to service providers and we worry about conflicts of interest, it's a complex lenses to look at life from. But there was another fallout, and the fallout was that at some point I went on NPR and I described some of the things that the nice people at Dental told us. And, I repeated some of the things that they told us. And then dentists started attacking them. And they did what is very common, is to say, oh, we didn't say that, we didn't do it, it's not our data, it's not so on. But you were there in the room with me.
I was there in the room with you.
And what do you remember from that discussion and that experience?
So I remember very much that they were interested in helping us with our research because they felt, as the insurer, that conflicts of interest were rife in dentistry, and they had seen many examples of this. So, they told us things like, dentists order X-rays up to the level that the insurance will provide coverage for the X-rays. So if your insurance covers X-rays for, twice a year, you will get X-rays twice a year. regardless of whether or not you actually need x-rays twice a year, right? Because
Yeah.
the insurance will pay for it, so the doctors bill for it. And that was something that we could see in the data itself, right? That was, but they also told us other things, I think, that were, you know, a little bit more about their motivation for understanding and wanting to participate in our research in this way. And one of the things that they told us was that, you know, for example, these x-rays that dentists take every 6 months are, you know, there's no clinical evidence that the x-rays actually show cavities between the teeth. So dentists take these to show, among other things, whether or not there's a potential cavity between the teeth that they can't see in an oral exam. Yeah. And they said that they had conducted internal studies and basically found that dentists had poor, what we would call inter-rater reliability, meaning that if you show 2 dentists the same x-ray, they will only agree about the presence of a cavity about 50% of the time, which is very alarming, right? I mean, think about that, like all of the diagnostics that we do. And I think that was very interesting to us, particularly because our paper, the motivation for our paper was about second opinions, right? And so imagine if we had more second opinions.
And if there's a low rate of reliability, then the opportunities, you know, when we think about dishonesty, we think there are very few crooks, but we think that conflicts of interest kind of tap human motivation. And if you are looking at something that is not as clear and the information is grainy and gray and not as clear and it's hard to find out, then it opens the but I just wanted to make sure that you remember as much as I do that the things I mentioned on NPR were the things that they told us. Plus, they told us all kinds of other things.
They did tell us a lot of other things. I don't want to repeat them now because I don't want to get them in trouble or make them uncomfortable. I think, you know, in part, this was one of the first times that we had worked with a company and, you know, I think learned a lot, right, about what we should talk about in terms of our private discussions, or at least ask them and get their permission about what we would talk about in these private discussions. Because, of course, you know, we want to work with them, and they were, you know, extraordinarily helpful. And I think, you know, I think it was a public relations problem for them, the NPR interview. However, I never felt that they would they didn't want to collaborate anymore. And I never felt that they were not continuing to support us because, you know, I can tell you, having worked with their claims data, you know, it's not intuitive how to work with this data. It comes with all of these codes, and how do you know that these two things are similar to one another? And so I worked with them very closely for months and months and months. And while they were not happy that they had been, you know, that we had divulged any of this information, so in such a public way, it didn't prevent them from signing off on the research or really continuing to work with us on this project. And I think it's important that people understand that, right? Is that,
you know, the way I feel
to this project.
And they kept on working with us and they wanted this. So, but the way I feel about it is something is wrong in dentistry. Delta Dental knew about it, and they were trying to do things about it, but they were very complex. I divulged it, and then people were upset with me. But the reality is that dentists were doing something that they shouldn't be doing. Dental were not able to deal with it, but eventually I was the one that was left to dry. And you know, when it happened, I didn't know what to do. Like, you know, I really felt bad for them. But you know, what do you do when I didn't feel like going on the defense and you know, you kind of, but it is amazing how punitive. I think also people have become much more punitive these days. So the importance of setting the record straight is important. But in any case, the inter-rater reliability they told us is about what I repeated, and hopefully by now it's much better, right? Maybe with better technology and
Yeah.
not that I think that conflicts of interest have gone away, but maybe some of the signals are better, and if the signals are better, then the role of motivated reasoning and conflicts of interest could be smaller.
Yeah, and and also I think it's potentially worth noting that the dentist disagreed with you. They were angry with you. Never once did they provide you with a peer-reviewed study that showed otherwise.
That's right. That's right.
Right. So you can argue all you want that this is not true, but at this point, like if you have data that suggests that the inter-rater reliability is higher than 0.5, you would show that data. But there's no evidence that that dentists can identify these cavities reliably, these between teeth cavities, and they tell you this, right? And,
Yeah.
it also like it's a very uncomfortable situation. I had one of these cavities last year, and the dentist said, "Oh, you have a cavity," and I said, "Where is it?" And he said, "I can see it on the X-ray." And I said, "How do you know that it's there?" And he said, "Oh, this is a very good X-ray machine." Like it's a very good X-ray machine. And I was like, all right, I mean, ultimately I was like, all right, if there's cavity, there's a cavity. And I submitted to it, even everything that I've known, everything that we've been through on this, I was like, I'm having a between cavity filled, right?
Yeah, I've actually changed my approach. I'm now much more on the watchful waiting.
Yeah, if it starts to bother me. Yeah.
Yeah. Okay, I have to go to the dentist soon. It's this new one. Janet, thanks for the time. Wonderful to remember, that was not just, I mean, we have lots of papers, but this was not just a paper, it was such a experience, right? Both the lab experiments, the field experiments, getting them to cooperate, the nightmares that came, the complexity that came with it. What a journey.
It was, yeah, it absolutely was.
Thank you very much.
Of course, anytime.
Talk to you soon.